I'm Dr. Liang. I have the kids call me Dr. Shu. I'm a pediatric dentist working at Grand Dental. I was born in China. In second grade, my family and I moved over to the US and then moved to Canada. For college, I came down to St. Louis at Washington University, St. Louis. I decided I wanted to do dentistry, so I went up to New York. Decided I like to travel a little bit, so I bounced to San Diego for my residency. In dental school, I met my wife who came to San Diego with me, and she decided she wants to do some specialty training herself. So ultimately, we moved down to Chicago. And throughout my life, when I had the opportunities to work with kids, I really enjoyed it. Being able to build that relationship and that trust. Later on, when I decided to go into dental school, the pediatric part of my rotations I always really enjoyed, so I decided to do pediatric dentistry. It is definitely a very unique but also fun challenge. Not only do you want to build that trust with the patient in front of you, but having the parents really trust you to take care of their child is very important too. Having a pediatric dentist build that dental home and build that trust from the very beginning when they're young. We do a lot of education, not just for the kids, but also for the parents, and we do a lot of prevention as well, and I think that's very important. Every child is different. Our role is that we have to break a cycle. If a child goes in and have a negative experience at the dentist, if they start developing that fear and they don't want to come back when they're older, a pediatric dentist with that 2 extra years of training is going to make it as comfortable as possible, is able to describe to the child all the sensations that they're going to feel and take away that surprise factor and hopefully remove that trauma.